Hello, today I will be introducing the assessment called the 9-hole peg test. I will demonstrate what the administration of it looks like, how scoring works, and how to interpret these scores. The 9-hole peg test is a standardized assessment, and it was originally designed by Keller and her fellow researchers in 1942. The main purpose of the 9-hole peg test is to measure unilateral finger dexterity. Keller and her researchers wanted to make this doable in a quantitative fashion. This assessment is designed for adults 18 years and older, and it is also utilized with diagnoses such as traumatic brain injury, multiple sclerosis, Parkinson's disease, and stroke recovery. This assessment can be done in a couple of different settings. The first is a neurological rehabilitative setting. The second is a skilled nursing facility. And then we also have a clinical outpatient setting or a hand clinic. Now we're going to discuss the strengths of this assessment. This assessment is very affordable as it is only $25.95, which makes it more accessible to many different settings. This assessment is also very short, which allows it to be done quickly and it won't take up too much of your evaluation time. The next two strengths we have is that it does not require any training to administer. And lastly, it's very portable. Now we will discuss the weaknesses of this assessment. The first is that it doesn't show real-life functional ability, since this is not an occupation the patient would perform every single day. It also only tests one area of functioning, so it should be used in conjunction with other assessments. The last weakness is that it may be sensitive to practice effects, so this should be taken into account when using it. As this assessment was established in 1942, it has had the chance to show reliability and validity. It has shown excellent retest reliability within stroke and Parkinson's disease populations, and it has also shown good inter-rater and intra-rater reliability within stroke and Parkinson's populations. It has found to have good construct validity in stroke populations. This is a very short assessment. It usually only takes about 1 to 3 minutes to administer. All you will need for this assessment is the 9-hole pegboard, a timer or stopwatch, a table and chair for the client to sit at, and it is also recommended to bring a pencil and paper to record those times. Moving on to what the setup would look like for the 9-hole peg test. First, you will place the pegboard in front of the patient with the pegs located on the side being tested. We will test the dominant hand first and the non-dominant hand second. The scores are based on the time taken to complete the test. The timer starts when the patient first picks up the peg, and then the timer is stopped when the patient places the last peg into the container. Now, I'm going to demonstrate exactly what the administration of the 9-hole peg test would look like with my patient here. Hello, how are you doing today?
Good, how are you?
Good, thank you. My name is Caroline and I will be administering the 9-hole peg test. Pick up the pegs one at a time using your dominant hand only and put them into the holes in any order until all of the holes are filled. Take the pegs out one at a time and return them to the container. Stabilize with your non-dominant hand to make sure the pegboard does not move.
Okay.
So first, this is a practice test. See how fast you can put all of the pegs in and take them out again.
Okay.
Are you ready? Go. we're going to do the real test.
Okay.
The instructions are the same.
Okay.
Are you ready?
Yeah.
Go. Faster. Faster. Out again. Great job. Now we will do the same test on your other hand.
Okay.
So we'll do one practice test, and then we will do the real test.
Okay.
All right. Are you ready?
Yep.
Go. Great job. Okay. The instructions are the same. We're going to run it through again. Are you ready?
Okay.
Go. Faster. Out again, faster. Great job. And this completes the 9-hole peg test. I'll now show you exactly what the norms for this assessment look like in a chart format. Now time for the interpretation of scores. The scores for the 9-hole peg test are based on age and gender. Typically, the dominant hand scores a better time than the non-dominant hand. The patient I just had scored a 14.54 seconds for his right hand, which was his dominant hand, and a 17.65 for his non-dominant hand. The patient performed slightly better than average for a male of his age. This indicated that he shows above average unilateral finger dexterity. While interpreting these scores, I came to the conclusion that this particular patient may have scored above average due to practice effects. Due to the setup of this video, the patient was exposed to the assessment prior to the practice test and real test. If the patient had performed below average, this would indicate a deficit or impairment in activities that require unilateral finger dexterity. A few ADLs and IADLs that would be affected would be opening a bottle, opening food packaging, sewing, typing on a keyboard at an efficient rate, organizing coins, buttoning your shirt, and zipping your pants. There are more occupations that would be affected, but these are just a few. Thank you for watching my presentation on the 9-hole peg test.